everybody. Welcome back to another episode of Not So Wide to Buy. Today we are super excited. We have another guest with us, and that is Mr. Bryon Jasper. Welcome, sir.
Hey. Thank y'all for having me.
And we need to excuse Cody. Schedule conflicts. It's either Tori or Cody. These guys just can't get it together.
Hey, man. Life don't always run on schedule, so sometimes you got to make the best of it.
Right.
I understand completely. But Cody, wish you were here because this is definitely something I want you to have some conversation with Byron about, because I know it's not necessarily something you disagree with, but I know it's something that you want to get educated on. So I hope at least you listen back to this. I know you will, because Cody's always he's always in the YouTube comments. But so I'll just kind of start off and throw it at you and say, man, give me a little introduction about what you do and a little bit of background.
Absolutely. So Bryon Jasper. Some people call me Dr. Jasper. Some people call me Dr. B, Dr. J. Most people in Houma go by my middle name. I was growing up here, they call me Kentrell. So I go out a lot, but most of the time my primary title is owner of a primary care practice called Byja Clinic. We're based out of Baton Rouge. We're the first Black-owned direct primary care practice in the state of Louisiana. And direct primary care is something that's pretty new and a little bit different from traditional primary care in that we do a membership-based model. And the idea is that patients pay us directly. They don't use insurance for our primary care services. And by doing that, we often cut down the cost and also streamline a lot of the medical care for a lot of people. A few other things that I do, I also have my own nonprofit working on getting more minorities into the medical field. And that minority focused nonprofit is called Comprehensive Medical Mentoring Program. And we're based in a few different areas across the country and also have a huge social media presence. So those are my two big lifts, and then just do other things here and there. So altogether, those are the big things, primary care focused, also trying to get more minorities into the medical field. And then the big thing I try to say is just kind of blazing your own trail. And more importantly, if you don't have that seat at the table, I just tell people build your own table. Because at the end of the day, if they're not gonna let you sit, then make your own way.
That's nice, man.
Yeah. Thank you.
Just listening to it and, growing up with you and playing sports, you would never think we would actually branch off into something like that. And
Correct.
then to, like you say, the primary care focus, to have your own set of standards to be able to get people in and taken care of is real neat without the insurance portion of it.
Correct.
And I'm sure, just like today, me listening to it, when our listeners and followers listen to this, it is going to be something that's new to them. So I'm just looking forward to hearing more from you.
Absolutely.
Yeah. I appreciate everything you bring to the table and to our community.
Yeah. I mean, again, it's not easy to do, but when you do it and you do it for the right purpose, people start to find you. Right. And it's amazing some of the reception I get from people when they're like, I heard about you from so-and-so. And it's usually the most random conversations. and that's, it's funny because it's one of those things where people approach me, we do advertising. We want to get you a commercial. And I'm like, yeah, I mean, I could, but it's funny because I don't know how many people would say, well, I saw the doctor on the commercial and I really wanted to go see him.
Right.
Most of the time it's, well, I heard about you from my relative or my coworker and they told me such great information that I had to call. And people just find me out of that. So just getting my name out there is good, but then getting the right people into the mix makes a huge difference. So altogether, like I said, I'm excited about it. We opened in September of 2020. So we're going to hit a year in about a month. And in that year span, we've done a lot of good work, and I'm really happy about it. Specifically, I wouldn't do myself justice if I don't take time to say that we are slowly growing to the point where we actually are purchasing our own building. And we're moving from the place we're renting to my own space. So that in a year, right? So that's just unheard of for a practice that doesn't have insurance, right? Insurance would come and usually give you 1,000 patients like that. That's just because that's the way they do. They give you the doctor has a list of patients. For us, we basically take patients one by one or small business by small business. So for us to be able to go from 0 patients to, okay, y'all are doing well enough to where now you have your own space. That's huge. So I'm happy about it, and I'm blessed to say that it's a labor of love, but it works out when you do it for the right reasons.
So what made you get into this specific model?
Mm-hmm. Yeah, I mean, well, I'll try to give you the nice version because I'll go from 0 to 100 pretty quickly. So the big thing for me is I got to the point where in the what we call fee for service or the traditional insurance-based model, Basically, a patient comes, they show you your insurance card, or their insurance card, I should say. When they show you their insurance card, you charge them for the intro, aka the copay, and then you see them, then they go, and then there's a bill on the back end. Usually that bill on the back end is the part that's not covered by the insurance. In that setup, the doctor is actually mandated more than likely by the insurance to do so many things. See the patient for 15 minutes, check so many boxes, do so many things, focus on so many parts, and then they have to chart in such a way that all of this is mandated and dictated by the insurance company. So in essence, the doctor works for the insurance company. A lot of doctors will never say that, but it's pretty true, because if you don't do what the insurance company says, you don't get paid. And if you don't get paid, you pretty much are doing free care. Most people don't want to do that, and then when you do that, you're seeing a bunch of patients. You're not giving them the best care, in my opinion, because you're basically relegated to 15 minutes to deliver comprehensive care in a primary care sense. And patients oftentimes have a lot of problems, and you can't do that in 15 minutes. So then what happens is you tell them to come back and come back and come back. And the patients have to come back 5, 6, 7 times to cover their problems. And each time they have to pay more and more and more. So for me, it was like, I mean, I could do that because that's how we're trained. In residency, you're trained in the insurance model. But then when I was the final year of my residency, I read an article about direct primary care. It just somehow came across my email or something. And I read it and I was like, it sounds really good, but it doesn't sound realistic, right? You want me as a doctor to stop taking insurance and trust that a patient's going to come to me and pay me directly and do that on a membership model every month. And I'm still going to pay all my bills. Patients are going to get better care. I'm going to have better quality of life. And I'm going to be happier and patients are going to be healthier. It just sounds too good to be true. Doesn't make sense. So that was in 2014. So then I left and did 2 fellowships in DC. So I advanced training for 2 years and then came back in 16 and worked for about 4 years. So literally all my time, I'm sitting here thinking about direct primary care. And the more I'm working in this fee-for-service model, insurance model, just getting worn down. More patients, more notes, more visits. In my opinion, things happen too fast. Patients often having more needs, more phone calls, more emails. All this stuff that just keeps happening and I can't keep up because it's just more stuff that keeps thrown at you because you have to see more patients. The way you get paid in the insurance model is by volume. You basically have people come in, and if they come in, you see them, you bill, you get paid. So if you don't see patients, you don't get paid. Now, you're not getting paid an exorbitant amount because the insurance company has to get paid too. So you get a cut of whatever it is you're billing, meaning you submit a bill, and if you say this bill is worth $100 for the care that I delivered to the patient, the insurance company says, okay, but we're going to give you 70. We take 30. And at that point, you're not getting paid the full value for what you delivered because the insurance company says so. So at that point, I just was like, it doesn't make sense to me to keep doing this if there's this other way. So fast forward to a conference that I went to in 2019. At one point, I was just like, look, I think I'm going to do this. I just need to figure it out. Went to a conference in Orlando and started meeting all these other direct primary care doctors. And I mean a lot of them, not like 4 or 5. I mean like hundreds. And they were like, number one, Byron, you just got to do it. There's no way we can explain it to you, but you just got to go ahead and do it. And then as I started talking to more people, they're like, yeah, I make my salary. I pay for my kids' school. I'm off on Tuesdays so I can go to their practice. I'm not at home writing notes till 9 and 10 o'clock at night, which is what I was doing. I'm off on weekends. My patients are healthier and they're happier. And I was just like, all right. So somebody's trying to steal my wallet, right? This doesn't make sense. So finally I said, okay, I'm going to really start looking into it after that conference. And I said, I'm going to do it. So by 2020, at that point, I was like, I went to the conference in 2019. I'm going to do this in 2020. And then the pandemic happens. And at that point, it got even worse. The volume got worse. The notes got worse. People were sicker. Black and brown people started having worse outcomes. More black people dying. Place I was working at didn't really give a shit. I'm sorry.
This is the podcast.
You go to our YouTube and it says children not welcome. Right. And there's everyone has explicit comments on it, so you're good.
Yeah, so the system I was in didn't really care. I mean, I was really, before this, and again, I'll go all over the place, but the thing is, before George Floyd, all that, I was already talking about diversity. As I mentioned, I had a nonprofit. My nonprofit started in 2015, working on getting more black and brown people into the medical field. So I already had a passion for this. I was already talking about diversity and why it was important. And then all these people are dying. Then George Floyd happened. So all this just hits the fan. And at this point, I was like, I already knew I was going to do it. But at that point, I was like, everything is happening to tell me not to do it. So if I don't do it now, when am I going to do it? More people are sick. I'm having less time. The diversity stuff isn't really a big priority for the place that I'm working at. So at this point, I was like, you know what? To hell with it. And I just said, I'm doing it. At that point, I literally said I had every reason not to do it. It was the worst time to do it. Businesses are going under. There's nobody who's actually wanting to give you money to start a business. Like, everything was against me, and I did it anyway. And at that point in September of 2020 is when we said, and you can go back on my Facebook page and everything else, is when I put the video out and said, I'm announcing in September of 2020, we're starting this direct primary care practice. And from there, it's been uphill since, not necessarily in a negative way, but it's been uphill because it's not something that anyone's just handing you, right? It's not a bunch of people knocking on the door saying, hey, Dr. Jasper, you've been in practice for 30 years. You've had 500 patients. We're all going to follow you. I had to start with 0 patients. So every patient that has signed up with me, I've earned. And it's been from talking, having conversations, and knowing where I stand, knowing what I'm about, and knowing how I operate. And all that being said, the mindset of me doing it is because it's better for me. The patients appreciate it more. I have more time with them. I have more time for me. I literally used to see 25 people in a day. The most I've seen in this practice is 5. 5 patients in one day. And in those 5 patients, the longest visit I had is 2.5 hours. Literally sitting in there talking about everything. Most of it is me arguing about why my sports team is better than theirs. But the idea is we talk about what they want to talk about. Right. And patients love that more, and they feel healthier when we're talking about what we're talking about. It's not, well, we had 10 minutes, I'm going to talk about your 2 problems, and then you got to come back in 3 weeks. And then we're going to do that all over again. And in between, you got a million questions and you can't get me on the phone because I'm doing that with 15 other people in the same day. So every day, I'm constantly doing something with a patient, Saturdays and Sundays. Before I actually walked in and sat down on this set, I was talking to 3 different patients via text message because the model allows you to text me directly. And it helps patients feel a lot more access to their doctor, which usually makes them healthier. So I understood why the conference in 2019, all the doctors was telling me what they were telling me, because it's true. You just have to understand it. And when you understand it, a lot of people appreciate it a lot more. And it takes a while, but after that education happens, people are sold and they love it. And I have patients say, I don't know why I would ever go back. I would never go sit in the waiting room for 45 minutes when I can come in and I see you at 9 a.m. when my appointment is set. So when their appointment's at 9, they see me at 9. If it's at 10, they see me at 10. They're not sitting in a waiting room. I have a beautiful waiting room. I have lovely pictures. I know because I hung all of them, right? But at that point, no one sits in there. Right. They're sitting there, and it's because somebody's finishing up, and my patients are more respectful. They'll say, I started at 9. You got another patient at 10? I'm going to end at 9:55. And I'm going to be respectful because the next one, I don't want them to wait because I didn't have to. It's a lot different, right? All of that changes when people start to see how this can work, but it takes a lot of work to get to that point. So very long-winded answer, which you already, as I told you, I like to
Very
talk.
informative.
But the idea is I got into it because for me, the old model didn't work. Old things that don't work, I'm not going to keep doing it. If diversity stuff isn't working, I'm going to start something else. If the insurance stuff doesn't work, I'm going to start something. Like, I'm constantly looking for new ways to make things better because for me, it helps to bring more people in that are like-minded than to keep fighting in a system that makes no sense.
Yes, sir.
So hopefully that makes sense.
Look, it's perfect. I'm just kind of scrolling through your website. Can you give me a breakdown of so I want to join, I want to be. So can you give me like a general platform of what to expect, how services work?
Absolutely. So again, the concept is we try to eliminate insurance unless you need it. So the way I tell people is we're like the Netflix of medicine. So you pay us a single monthly fee and you can use our services as much as you want and the fee stays the same. So with Netflix, you can watch 8 million shows and you still pay 1 fee. You can download, you can subscribe, you can do all that. It's 1 fee. For us, same thing. As long as you're within our primary care system, it's 1 fee. Now, if you have to go see other doctors and get referred and do stuff like that, then there are other fees, but we always try to get them at a discount. So there's a bunch of layers, but I always try to go layer by layer. So the first layer is we do age-based pricing. Age-based pricing means we have 4 different tiers in my practice. Now, other practices across the country do it differently, but mine is age-based. So from 0 to 17 is one price. Then if you're a full-time college student or a grad student, it's another price. If you're an adult, it's another price, and if you're a senior, it's another price. And we do that to try to spread out the cost, because I knew what it was like to be a college student. I didn't have no money. So if I needed to go see a good doctor, what would you do? You would either hopefully be on your parents' insurance, or you just didn't go to the doctor. You just got sicker. And that's the problem we have. So we're afraid to go and get care because it's so expensive. So we just get sick. And that's why all these people are dropping like flies in the pandemic, because they're so sick and it's so expensive. They just get worse, and then they show up and it's so hard to fix them. So if we eliminate that barrier to care by making access more affordable, people are more likely to go get care. So I have a guy who literally signed up with me, and he said, Doc, I'm gonna be honest with you. I used to never go to the doctor because I used to say, how much is it gonna cost me? And I feel like shit. Literally, he said that. And I was like, so what is it now? He said, look, I don't even worry about it. He's like, anytime I got a problem, just call you. Or I just show up here. And he literally just shows up, like,
no appointment.
No appointment. Because he knows I'm there and I'm just sitting around usually talking to people. And he's like, I was just coming by to say hello. And he feels so much better, not just physically, but mentally. The stress is gone. When you get sick, the first thing we often do is, what do I do now? Do I go to the hospital? Do I go to the urgent care? Or do I call the doctor to try to get an appointment? If you call the doctor to get an appointment, how long do you got to wait? And if you got to wait a long time, now you got to do another set of problems. Do I now wait? Do I go to urgent? So all of that goes out the window. Anytime my patients get sick, they just call or they text me. And they ask me, what should I do? And I tell them, you need to come in or go do this. And then all the stress is gone. The cost is gone. Everything is better. So from the model is signing up with the cost, whatever the cost point may be. And once you sign up, you're enrolled and we start your services that day. So if you need an appointment, it's usually that day. If we have availability, as I told you, I see 4 or 5 people in a day. Most of the time my schedule's open. They can come see me, or they schedule the next day. Or we do a virtual visit, which is included in that month services they get. As I mentioned, they can text me, they can call me, they can email me. So if the phone, if they have a problem and they call the clinic, it rings to my cell phone. If they have an issue and they don't necessarily want to call, they can text me. We have a text message conversation. We do virtual visits in that fee. We also do other primary care things like procedures. So if a person had a real bad laceration and they need stitches, I'll do the stitches and I don't charge them for it, because keeping the cost down. The only thing we charge for in the actual fee, in the membership model is the medicine, because I got to pay for the medicine. So I basically pass the cost on to the patient, but I tell them what it is up front. So if you say, Doc, how much is it going to cost me for an injection? I don't say, well, I don't know, the insurance is going to cover it, or you're going to get a bill from your insurance. I tell them it's $5. And most people is like, what? You mean like 5? And I'm like, yeah, 50, with a dot in between the 5. Right? And they're surprised. I had another lady, one of my favorite. She asked me, she had hurt her knee. And I also have the ability in the state of Louisiana to prescribe medicine and dispense medicine in the clinic. So I write the scripts. I go to my cabinet, I count the pills, I put it in a bottle, and I give it to the patient, because in the state you can get that license. So a patient, long story short, hurt her knee. She needed anti-inflammatory medicine. I wrote the script, I gave it to her, and she said, well, how much does the medicine cost? For 30 pills, it was 97 cents. She said, 97 cents. I said, yeah. She said, I'm going to go get that out of my ashtray. I was like, I don't want your ashtray money. I was like, we don't want that. But the idea is that's how inexpensive it is when you cut out insurance. And a lot of people don't like that in the insurance model, because that's how they get paid. But it is indeed one of those things that can happen. You can save money when you only use insurance when you need it. So to give you another quick concept, it's like car insurance. With car insurance, do you use it when you go to the gas station? No. Do you use it when you get your oil change? No. You don't have anything. So at this point, the idea is that if you don't use your insurance a lot, you save. But if you're using insurance in every single thing, it ends up being a problem, right? You have expensive care, because insurance is so high on the healthcare side, because you use it for everything. You walk into the doctor's office, let me see your insurance card. You need a shot, let me see your insurance card. You need an x-ray, let me see your insurance. There's nowhere where you don't use it. So the cost is extremely high. That's why it's high to get insurance at that level. But at this point, if you cut out and only use it when you need it, the cost goes down. And people are surprised when I say that you can possibly get medicine cheaper without insurance than you can with it.
There's no doubt about that.
So all of that is things that are surprising for me. So at that point, I'm not sure what the difference is for a lot of people, but altogether, it's one of those things where I tell people it's easier to do if you learn how to do it.
All right.
Yeah.
So what's the average cost for somebody on a, not insured, don't have any insurance? I'm a self-employed electrician, plumber, whatever the situation is. Yeah, an adult, like, you and family. I got 3 kids. It's going to cost me $1,500 a month to go get insurance through Blue Cross Blue Shield. I just can't afford that.
Yeah.
Go through you, sign up through you.
So the highest price, and I always make it easy. The highest price for us is $120 per month per person. That's an adult in the adult category. From there, everything's cheaper. $120 a month. So you say, what's $120 a month? I make it real simple. I say, how much would you pay to have access to your doctor 7 days a week, access to your doctor after hours, access to the doctor with the phone call, text message, or email? Ballpark, how much would you pay in a day just to have that for 7 days?
Yeah, I mean, I don't know if I can put a price without actually really.
But you would normally be what?
It's
like $10, $20 a day.
$20 a day. Okay.
Right.
Easy.
So for mine, it's literally $4 a day. Do the math. 4 times 30 days in a month. $4 a day. $120.
Oh,
Not rocket science, but people are like, wait, $120? That's expensive. For some people, it is, and I completely respect that. But I tell people, you get what you pay for, right? So you can go into the system with the very low quality insurance-based model that you really and truthfully will cuss and fuss about when you're in the emergency room, and you can't get into the emergency room and you feel like utter shit. You literally will sit there and say, I wish I could get in to see the doctor like that.
Yep.
Or when you are ill and you literally need an appointment, you're like, my doctor said I can't get in to see him for 3 weeks. You would say, if I only had $4, I would spend the $4, right? So when patients literally start to think about it, it sounds expensive when you don't need it. But when you do, you're like, man, I'm glad I paid that money because now I don't have to stress. When I'm sick, I call my doctor. He answers. If I don't get an answer, he's going to call me back. I shoot him a text, he texts me back in a couple of minutes. Like, that's the cost that you're doing. So you're paying for the service, not just the mindset of, I'm paying $120 a month to go to the doctor. No, you're paying for everything else. You're paying to call me, text me, email me. You're paying for my medical advice. You're paying for the access after hours. You're paying for my knowledge to get you to places where you won't necessarily have access to. And then you're paying for all the discounts that we provide, like the medicines I told you about.
Right.
When we cut out the insurance, the medicines get a discount. Same thing for labs. If you literally say, how much would it be for my labs with my insurance? I can tell you what I think it could be. You might get a bill on the back end. The guy who I have, he's a barber, owns his own shop, literally has no insurance. His wife actually has insurance. So he has insurance through his wife. He's a self-employed business person. He literally asked me about labs. I said, okay, if we give you the opportunity to do your labs with your insurance, they may cover it, they may not. But I can tell you, I don't know how much it's going to be, but I can tell you what my price is. He said, okay, let's do it with the insurance. We tried it with the insurance. His insurance charged him $200 for 4 labs, a metabolic panel, a blood count, cholesterol, thyroid. 4 common things we order all the time. $200, 4 tests. With me, $22.
Man, you hear this?
22. And I told him up front, before the $200 charge came, I said, it'll be 22 with me, but you can try it. Your choice. He said, well, let's try it. It might be covered. It might be. But you best believe, every time since then, he's like, $22. Let's do 22.
I'll give you another perfect example of that. So, Wendy that we went to school with, she has a little wellness thing she opened up, and she's been pushing the vaccine, the vitamin thing. And friends open business, try to support them, like, hey, go check it out. Well, Kim has gone, she gets vitamin D and vitamin B shots like once a quarter from the doctor because that's been what she's needed. And so she tells this when we're getting the vitamin IV, and she says, what are you paying? She said, I don't know, you got to pay a copay. And then we have to, the shot's like $25. And she's like, I can give you a 6-pack of shots for like 70.
70, right? Yeah.
Like,
yeah.
And we'll just keep them here. You want to come once a month to get them. It's like, wait, hold on. It's like 110 per visit. You're saying 70, I got 6 months worth. It's like, yeah.
And that's the point. Like, people don't realize that when you are in certain systems, the systems are set up for the people who know how to work the system. So the people who run the system in the traditional healthcare-based model in America is people that are profiting on the idea of insurance. Insurance wasn't set up oftentimes to literally pay people what they are needed. They deny coverage a lot of times so the people in the insurance model can save money, right? If insurance paid every time somebody filed a claim, there wouldn't be any insurance. Everybody would be broke. So they're going to literally in healthcare find a way to make the coverage cover as many people as possible and give people access, which is beautiful. But then there's a
deny
limit
claims.
where all of a sudden you start to see that things are overcharged, right? A bag of medicine in an insurance-based model in a hospital is marked up so much that you don't realize how much is marked up because you don't get the bill until 6 months later. And at that point, what you gonna say? I ain't gonna pay it. I mean, at that point, you already got the medicine. But if they told you up front that this bag of medicine is $1,000, what you would say?
I'm
I'm all right.
Right.
I'm all right. I don't need $1,000 worth of liquid, right? I'd find this, but you'd never know, so you just say yes. But when you know how much stuff costs up front, you make different decisions. And all of a sudden, you are financially healthier, mentally healthier, and physically healthier. And people don't think about it like that. They think medicine is one size fits all. You do what I say, and if you do what I say, everything else works out. And that's where you start to get into that gray area of when to listen and when not, and that's a whole nother conversation. But what I say for this model is that when I give you all the information up front and let you make your decision, you usually feel better. And you can literally help the people by guiding them and not necessarily telling them what to do. And when people ask me, I tell them what I think, but I never tell a person, do this because I'm the doctor.
Right.
I tell them, do this because this is probably what's going to be your best outcome. And we work together. So in that tiered-based model with the children, the college students, the adults, the seniors, all of the pricing is up front. It's on my website. You literally can go to the website and find the pricing right now.
What's your website, Byron?
So it's www.byja.org. And the BYJ is Byja. And people will say, well, what does Byja mean? It's really not that complicated either. It's the first two letters of my first name and the first two letters of my last name. So,
I had it pulled up, but I saw
yeah.
the TV was messing up. That's the thing. That's why I kind of pulled it back
right,
down
so
to see if it comes back up.
so Byja Clinic, the idea is that direct primary care, the model is transparent pricing, and the transparent pricing is on the website, and it's not hard to understand, but we're here to guide people in the event that they don't understand it, because it can be tricky, right? And I never have anybody sign up with me unless they're comfortable. I have people who do consultations with me. We literally allot 30 minutes for them to sit down and talk to me. Before they do anything medical, before we sign any papers, 30 minutes to just ask all your questions. Literally nothing charged for 30 minutes to sit with the doctor and ask, how does your model work? How does the billing work? What do we do? What do we don't do? All of that for 30 minutes. And we do that over and over again until a person's ready to sign up. I had one guy from Homa call me in January of 2021, had his consultation, disappeared for 3 months, then call back in April and say, okay, I'm ready to sign up. And I said, okay, like nothing changed.
Right.
It wasn't, well, you didn't sign up in January, so the price didn't went up.
Right.
No, same price, right?
Right.
It's going to be the same price for a long time unless something changes on my end. And like I said, the pricing is there. And we do family pricing too. So when it's more than one family member in the same household, a spouse and a child, or I'm sorry, a husband and a wife, or a spouse and a spouse, or a father and a son, I have all these combinations where people sign up based on their family structure. And when we do that, we bundle the cost, and the cost goes down. So if it's 2 adults, instead of it being $120 per adult, it drops down to $100 per adult. And the 2 adults literally will be $200 per month instead of $240. And then we literally do that to try to help people with the cost, right? We save money. So I have one family, the mom signed up. She doesn't have insurance. She can't get insurance. She is not able to get insurance because of cost and other factors. Her and her 2 kids signed up. So between her, $100, her 2 children are less than 17. So instead of it being, I think it's 45, or we got this pulled up,
Yeah.
40. Instead of it being 40 per child, it dropped down to 20. So for her and the 2 children, it's $140 to all see me as much as they want. And the children, one is 2.5, and the other one is 5. And you can imagine how quickly the mom started blowing the phone up when she first started. And it wasn't because it was a problem, it's because she wasn't understanding how it worked. And I loved it. And now, she literally, I hear from her once in a blue moon. I did such a good job on the front end, and they're so good, and they're taken care of so well, they don't call me.
Right.
And that's one of the things the doctors will say, well, you're on call all the time. Don't your phone ring? No, actually, I get more. They call me when they need it. But because they know they won't have to stress when something's wrong, because they know that they're going to get an answer. So she literally texted me 2 days ago and said, hey, Dr. Jasper, I'm sorry I hadn't done a response to your message, because I actually messaged her more. I'm like, hey, I'm just checking on you and the boys. How y'all doing? Oh, well, they're doing great. He got his shots. And that, speaking of that, I'm going to come back to that. He got his shots. He's doing fine. He was having these difficulties. I'm doing great, and I'm taking care of everything. I just wanted to say thank you for checking on us. How many times did the doctor call and just check on you?
I've never been called by a
Right.
doctor.
Just randomly, right?
Never.
Just randomly to say, how are you doing? Are you okay? How are the kids doing? Right? And I do that often just because sometimes I just wonder, hey, hadn't heard from you in a while. What's going on?
Time.
Yeah, and I have the time, right? Like, insane for me to have time to call people. Like, what kind of field are you in, sir? Right? To call people and ask them. But I mentioned
medical follow-up
right.
is amazing.
And I mentioned that, and I'm going to tell you this other story. Same family, mother and 2 children. Don't have insurance. You mentioned about the infusions, the vitamin D, vitamin B12. Mom said she was going to a healthcare clinic. Every visit, $300 a pop for her kids. $300 a pop for her kids. That's not with the shots. 2 to 5, so they need vaccines. They have to get vaccines to go to school. She said that every time she would pay $300 to go and get the visit, she then had to pay another $100 or something dollars for the shots. So she's paying almost $500 for a visit. She came to me and I told her, by you not having insurance, in the state of Louisiana, they usually have what they call a VFC program, Vaccines for Children. So their vaccines could be free if you go to the health department. Send her to the health department, ain't had to pay for a vaccine since. And all of that for $140 a month. Not a visit, a month. You best believe that she one of my best patients, because she's like, wait, I went from paying $500 a visit, and I would have to come here every 2 to 3 months to paying you $140 a month, and I can see you 7 times and it's still $140.
Yeah, I mean that's 2 visits a year.
Right.
She can see you every month.
That's right, and that's
she can drop in just to have coffee.
Just right,
okay.
and that's why I said people are surprised when they understand it. But the first thing is I call a sticker shock. How much does it cost? And when I tell them, oh, that's a bill. I could pay my energy bill for that. And I'm like, yes, you could. I'm not arguing that point. But how much is your health worth? If it's not worth $4 a day, and that $4 is the high price, right? It actually is lower than that if you're in different categories. If it's not worth $4 a day, then to me, I'm not the problem. The cost isn't the problem. It's just that your priorities are different.
Right.
When your priorities shift, eventually you will say, this is worth it. And that's with insurance or not, meaning I have patients who do have insurance, and we use their insurance when they need it. If it's covered in full and insurance covers the cost and it's free to them, we use the insurance. But if we find that my price, my discount, whatever, is cheaper, we don't use insurance and they save money. And I had another guy, Blue Cross Blue Shield, I never forget it. He called me and said, Dr. Jasper, I have acid reflux. I have a prescription for acid reflux medicine. I take one every day. How much does it cost if we go through your clinic? I said, well, how much does it cost through the pharmacy? He said, for a 30-day supply, it's $10. I said, well, what if I told you I can get you 90 days for $6? He said, wait, 90, meaning 3 months, for $6, but 1 month is 10? He said, what you doing, stealing this medicine? I said, I guess I am, because at this point, it seems like highway robbery that y'all are literally having to pay this much, and you just don't know any other way. And people sometimes love it, some people don't like it. Why do not people? I've never heard a person come to me and say, Dr. Jasper, I don't like what you do because what you're doing is wrong. They say, I don't like what you do because you're taking my money. Right? If I'm literally telling people you may not need to go to a pharmacy, some pharmacies don't want to hear that. But there are pharmacies out there that see how we work and they know I won't stock everything. There are going to be some medicines there's no way I can get my hands on. Then what do you think I send them? This pharmacy is great because they work with me.
Right.
And I'm going to send you to them because they're going to scratch my back and they're going to say the same thing. You probably want to go see Dr. Jasper because you're having trouble with your primary care doc. Go see Dr. Jasper and I'm going to send them back. And my point is all of us can win.
Right.
And a lot of people don't think that. It's this crabs in a barrel mentality. I got to be on top, so you got to be on the bottom.
Right.
And I'm not about that.
Partnerships are the best way for any, especially, just any community, man. I mean, that's the...
Yeah, and that's what I said. The pharmacists, there are insurers that will work with you that will say, okay, well, look, we know you don't really deal with the ton of insurance, but when you have someone who needs insurance, give me a call. Absolutely. I have no problem with that. It's just when people start to feel like you taking my money, so now we got to fight.
Right.
And I ain't about fighting because at the end of the day, it's a waste of time. So for me, it's finding a way to work with people who understand the model, who understand how we work, and we do well. The people who don't, look, God bless you. I'm glad you gave me your opportunity. I'm not going to argue. I'm not going to even try to trick you.
Right.
People call me all day, and they literally say, how much? I tell them, okay, no, that's not what I want. All right. And the part that always blows their mind is that I will give them other primary care doctors.
Right, to go to.
And like, okay, well, you're not coming to me.
Call back.
Okay. I'm going to give you 5 other people. When you're done with those 5, if they don't do really well, call me back. And you best believe I've had.
And there's no contract. There's no time. It's just
there is an agreement. The agreement is literally technically, and I'm literally saying it's a year. And you'll say, well, I got to sign up for a year. No. We say a year because I just want to be able to put a time that if I need to revisit something,
Right.
I got a year. People can unenroll when they want. If you literally sign up on Monday, you thought it was going to be whatever, and on Wednesday you change your mind, I'm going to unenroll you, I'm going to give you your money back.
Mine is $8 though, right?
It'll be minus $8.
Right.
I'm gonna charge you what I did for you, but I'm gonna give you. So if a person pays me $120 on the first and they unenroll on the 15th, I'm gonna give them $60 back. I took care of you for 2 weeks. That's $60. I'm gonna keep the 60. You keep the 60. You go about your life. I'm happy. You happy.
Yeah.
I'm not gonna argue with you.
You can't lose that
Right?
way neither.
No, I'm not gonna argue with you. So people literally sign up, and I guarantee.
I think you gained the family already today. And I got insurance.
And that's why I say, like, a lot of people, it's surprising not because what we do is surprising to them because they actually, are surprised, hey, number one, he cares. I didn't sign up for this because if I was trying to literally make bank, I would have stayed where I was at. I got more money by by seeing more people. All I had to do was see 40 people a day, and you say, well, that's a lot. Yeah, it is, but people do it.
All right.
The doctors who see 40 people in a day make bank because they get paid per head. Think about if you're a barber, how much you get paid?
$25, $30
Per cut,
a cut.
right? Per cut. You don't get paid because people just sit in the barber shop. You get paid per head. So the more you cut, the more you get paid. So you best believe a barber who does a lot more volume is going to get more money. So the doctors who see more patients are going to get paid more. So we're not going to be the top earners. But I bet you my quality is better.
All right.
And I bet you my patients are probably more satisfied because I've yet to hear a patient call and say, Dr. Jasper, I couldn't get you on the phone. Dr. Jasper, you didn't respond to my message. Dr. Jasper, I didn't have ability to see you. I've had people sign up and they'll say, well, when can I come in? And I'm like, well, I got an opening tomorrow at 7. And you know what they'll say? Oh, that's too early. I thought you was going to say 3 weeks from now. I was like, oh no, I'm at the clinic. Right? Like a lady texts me and she's like, can I come in? And I'm like, I'll be there at 2. And she's like, oh, it's 11 right now. I can't get there. Like in their mind, they're so preconditioned to think it's going to be 4 weeks.
It's amazing.
So when I tell them it's tomorrow, they're pleasantly surprised. And if I can't get them in that moment, I tell them, look, I can't see you in the office, but I can hop on the computer and we can do a virtual visit right now and knock it out. And most of the people are like, that's fine. Can you just call me and talk to me on the phone about it? Sure. And I tell them, look, I'll have time at 3:30. I'm going to call you at 3:35. And most of the time, patients literally appreciate that access. And that's what you're paying for. You're paying for the access to a high-quality physician in a model that will allow you to keep your costs down. Is it a cost? Absolutely. But as I said in the beginning, you get what you pay for. And if you don't want to pay for it, don't. Stick with what you got. But at the end of the day, when you're literally sick, and I've had people sign up for me after they got COVID, and they called their primary care office and they said, we'll be with you in 3 weeks. They can't breathe, they're miserable, and the doctor said 3 weeks. So what you think they did? Dr. Jasper, when can you see me? Tomorrow. How many papers you need me to sign? Like at that moment, they're literally like, I will sign whatever you want. And I'm like, that's fine. It's up to you to find a way to make it work. And the more that we have that conversation, the more people actually appreciate what we do. But it's getting people to understand. Because when you don't understand, people are nervous, right? They're nervous about what they don't understand. Anyway, as the more they get it, they start to tell more people. And again, we're starting to grow even faster to the point where people are calling me and I'm like, I'm going to have to set something up with you in a day. And that's not usual for me. It's usually I can talk to you at that moment. But I'm so busy trying to get other people to do stuff that I'm going to have to hire more folks and things like that. And that's okay. But I like it when people know me and they know what we do. And that's part of the reason why I always try to tell people, look, there's a different model. You just have to find it and find what makes you comfortable.
Why is this not more popular?
I think it's not because it's a risk. It's risky, right? You have to bank on yourself, whereas in the insurance model, you're handed 2,000 patients. You literally sign up to take Blue Cross Blue Shield, and Blue Cross Blue Shield will give you a panel of patients. So doctors are taught in that model that you take insurance because that's what you do. Your learning is based on people with insurance.
And that's the whole in-network thing, right?
Mm-hmm. Absolutely. So you can have people that are out of network, but most of the people go to people in your insurance network because it's cheaper. It's cheaper. If you're out of network, you pay more money, or they don't pay you. The insurance doesn't cover it at all. You got to pay for the whole thing. So when we are trained, oftentimes we see patients who have insurance. So when you graduate, you're going to more than likely go to a practice that takes insurance. And why? Because they also will pay you a salary. And your salary is more than likely guaranteed because you're taking insurance. The money is there.
So the insurance is paying doctors directly for this.
In a weird way, yes. And what I mean by that is
Maybe not like,
right. It's not Blue Cross Blue Shield writing you a check, but when you see the volume, the check comes to the institution pays the doctor. So that's kind of the people don't do it because it's a risk that now you're literally banking on you to get patients. And if you are a good person that can do stuff well, it's not a real hard gamble. I know I'm good. And people don't like when I say that, and that's okay. You don't have to like the fact of what I'm saying, but you respect the idea that I have confidence. And I'm good at what I do, so I know I can get people and care for them better than most people. Like, it's insane to me that people are surprised when I tell them they got some dumb doctors out there, right? Like, just like there's dumb lawyers. You know, it's not the idea that just because a person has a title that they're good.
Right.
They might be good at something. They might have taken tests very well, but they have horrible bedside manner. Or they have really good bedside manner and they're not really good at tests. Like, we all fall into somewhere in that category. So all that being said, I know I'm good and I know that I can do this model. It just took me to get all the ducks in a row. But other people don't want to do that. Other people don't want to be a owner of a business. They want to be an employee. They want to go in, they do this, they go home.
Certain things, go home and leave it alone, right?
Right. And they don't want to look at balance sheets, right? And I know you're on the finance side, so they don't want to look at accounting. They don't want to look at paying bills and wholesale medicines and sitting in meetings and all that. For me, I'm okay with that. So that's why it's probably not the most popular model for physicians. For patients, it's not popular because, again, we're so used to being told, you can't go to the hospital unless you have insurance. You go to the emergency room, they'll treat you, but they always ask you what when you get there? What's your insurance card? What insurance you got?
Right.
It's just ingrained that when you hear insurance, when I finally have a doctor come to you and say, well, you don't need insurance to see me, you start to look like
something
up, right? Like, what you trying to do, right? So when I have patients,
they start looking on the wall and saying,
exactly,
is that like real?
That's a real
certificate
degree,
over
right?
there?
That's a real one. So when you realize that you don't need it and you start to learn how to navigate without it, you start to say, you know what? I get it. And it's not hard. It's just different.
Right.
And that's why I would say it's not as popular because the things that have been put together are so ingrained in the insurance model in America now, not in other countries. But in America, the insurance model is king. So having somebody come in and say there's a different model is going to be really hard because now you have to fight against all these other people, right? And that's just really tough for some people. And docs, they don't want to do that. They want to go ahead, take care of patients. Hopefully,
they're not really taking care of patients, though. Like you said.
Yeah, and I would feel like this: they are, but there's probably a point where it stops. Right. When you're starting out as a new doc, you're not seeing 30 patients in a day. I don't care how good you are. Like when I came out of residency, people didn't know me, so you don't go to a doctor because they are next door. You go to a doctor because somebody told you about them, or you heard about them, or you were referred. That's why we talked about it. Like I can put up 15 commercials. Most people aren't going to be like, well, that commercial was amazing, Dr. Jasper.
Right.
I had to call you. They're going to say, nice commercial. So I'm going to have more from a referral. So the idea is when you're coming out, your volume is so low, you want to make sure you pay your bills. Our loans are expensive, right? We've taken out so many loans, most of us, to go through medical school that you need a salary to pay your loans back. So at this point, you're not going to hang a lot of us don't hang our hats on, well, we're going to start a clinic. We have all these loans, we don't have a guaranteed base of patients, and we just want to basically start making enough money to live, right? That's really hard for a person coming out of residency. So the doctors who often do this model are ones that have been in practice for years, 10, 15, 20 years, when they've been doing it for so long and they're now burnt out, so they switch over. But there are a bunch of doctors, younger side like myself, who are more inclined to say, I'm coming out and I'm just going to do this right out of the jump, right? I don't want to wait. I'm going to just start doing this because I don't want to get into that burnt out stage. And now I need to switch over. They just do it. So we're all over the scale as far as who's doing it. But if you say, well, again, to answer your question as plainly as possible, people are not used to it, patients. Doctors are afraid because you got a lot of debt, a lot of things that you need to do, and this is not guaranteed. A salary is guaranteed. When you're working with these big clinics, these big hospital systems, those paychecks are guaranteed at least for 2 or 3 years. You're on a contract. And then eventually you have to start basically making your own. So in the beginning, most people just do the insurance. And then once you're in, you're like, look, I'm going to just stick with this.
You get comfortable.
Yeah, absolutely.
Man, so I'll just kind of translate because, I mean, I had a whole bunch of other questions, but you've answered so many just running through the gambit.
Yeah.
So I guess we'll go to the whole COVID, to vaccines. What's your?
That's just your piece.
I'm good. I mean, mean, give me your take on that. Like,
Yeah.
where do you fit in, and how does your clinic work with,
So vaccines are tough, and I'm gonna say it's tough not because of the concept, not because of where I stand on it. It's tough because a lot of people just have an aversion to new stuff. It doesn't matter. Take it out of healthcare. If I say, look, I got a new restaurant, what you usually say? Let me figure it out. Let me wait till it's been there a while. You're not the first person to run into the restaurant and just start ordering stuff. So you got to learn about it. So the same thing happens in the medical field. Vaccines are often studied for a long period of time before they are brought to fruition. And this one is no different. People think that the COVID vaccine came in 2020, and I wish that was possible. But that vaccine has been in studies for almost 10 years. The pieces and all the stuff that went into it has been around for a long time. What happened in 2020 is they just started putting it all together, and they did it a lot faster putting it all together because they had a lot more money flowing into it. But the studies, the research, all of that had been around for decades. And from there, 10 plus years of having that research, it's literally a safe and effective vaccine, but people are afraid because in their mind it happened so soon. That's the idea that most people have. But then you have the gamut of people, as you would say, that they just don't believe or trust anything. The only people they trust are themselves and maybe one or two other people. And the people they trust are often the people that they shouldn't. And it's not because the people that they trust are, in essence, wrong. It's that they're in the wrong field, right? If I am a chef and I'm telling you about how to season something, you're more than likely going to say, he knows what he's talking about. But if I'm a chef and I'm telling you about how to measure cholesterol, at that point, you should be like, I appreciate you, but I don't know if you're the best authority. But that's not how it works in the medical field. I wrote a long piece on Facebook and on a bunch of platforms about why the vaccine should be received. And I talked about different reasons, and I wrote it. And one of the things I talked about was the fact that a lot of people like to get their medical advice from non-medical people. No idea how that happens. That's like a person coming in and saying, I just got into a lawsuit. Let me call my cousin to get legal advice. Nobody ever says that. Nobody ever says, I actually got into an issue where my house got struck by lightning. Let me call my pastor to worry about insurance stuff.
Right.
That doesn't happen. But in medicine, we call everybody but the healthcare people. Everybody. Let me call my aunt, my church member, my coach. Like, it's everybody but the medical profession. And the issue is not because we prefer those people. The cost is so expensive. The access is so hard to get that you go through everybody before you go to the healthcare system. And that's where the gap is. And that's kind of why I'm doing what I'm doing to try to fill that gap. So when it comes to vaccines, I encourage people to learn about the genesis of it, how long it's been around, what it does, and all of that. And when you get to the point where it's too much, that's when you talk to the healthcare professional, the knowledgeable person, not the TV, not the politician, not the person who has some skin in the game, but the person who's been trained and hopefully has enough sense to tell you yes, no, maybe so. And from there, you'll probably say, okay, I'm not going to do it, but I'm not doing it because of this. It's not, I'm not doing it because of everything that makes no sense. What I read online, what I saw on TV, so-and-so said, like, it's legit. I'm making the decision because I'm knowledgeable and I just don't want to do it. I don't want to. I feel for this. I have a aversion to this. That's fine. I have patients who don't do stuff all the time. But my difference is I'd rather them say, I'm not doing it, but I'm knowledgeable.
Right. And
I'm making an educated decision for me, or I'm making a decision that I feel is best for me, compared to I'm not doing it just because I don't feel like it. I'm gonna read about it, but then they never do. So I do think people should do it. It's been around. It's safe. It's effective. Yes, people are like, well, why are people having breakthrough infections? Because that's how vaccines work. Vaccines are not the thing that cures. Vaccines are not antidotes. It's not a treatment that fixes stuff. It's basically something to prevent it. And then if something still happens, it makes it less severe. Once the severity is actually addressed, the more that the infection stays, it mutates. It's always done that. Why do you get a flu shot every year? Because the flu virus mutates every year. So that's why you get another shot every year. It's not I got a flu shot, I'm never going to get the flu. But people think that when it comes to certain illnesses, polio, smallpox, things like that, well, those vaccines work. That's because those viruses and those bacteria don't mutate. When they don't mutate, you can find a vaccine and you can eradicate it, because once you've cleared so many people, then you clear the infection. The people who unfortunately have it die off, and then the vaccine has been effective because there are no new infections happening. But the virus now is mutating so fast, it's starting to cause these vaccines to be less effective. So now you need another booster. So in the science world, this makes perfect sense to us. And if you talk to the medically trained people, we'll tell you this is all normal. But it's when they start talking to everybody else that all of this stuff comes out. And then we have 15 more, 20 more, 30 more minutes, hours, whatever, of trying to explain to people stuff that's really simple, that if you engage with us on the beginning, then these conversations aren't hard. But when you come to us and you're literally wheezing, short of breath, feverish, can't stand up straight, and all of that, you're in the hospital, and now we have to fix you with all the same stuff we would have told you before if you would have listened to us, right? I had a patient who literally, direct primary care patient, long story short, didn't listen to me when I told him to get the vaccine. Did not listen when I told him to get the vaccine twice. Came in, looked like pure, you know what. He literally came and stayed, and I told him, okay, we're going to try to treat you and get you better. He left my office. After he left, about 4 days later, he said, I feel better. When should I go get the vaccine? I said, as soon as you can, but I'd wait another day or two. 2 days after that, he was literally short of breath, winded, feverish, sweating, said his wife had to change the sheets and all that other stuff. He literally said, I went and got a test that day and I was COVID positive. I said, yeah, it sounded like it. That's why I said I would probably wait. A week later, he couldn't breathe. He was in the emergency room. And he called me from the emergency room. And what do you think he said? Doc, I'm in here by myself. Nobody can come in. I'm scared. Grown man, like prideful man, 2 kids, never shows emotion. He was scared. And I understood, because people don't think about, when I get to the hospital, I'm by myself. And everybody is by themselves. You're not in there with 15 people. Your family members can't come in and out. It ain't like that anymore. You're sitting in the hallway, can't breathe, and they're working on everybody else, and you just sit there, struggling. And people are like, well, I don't want that to happen to me. Well, why don't you listen to us tell you, go get the vaccine so it doesn't? So best believe this guy was in the hospital, in the emergency room. He said, I feel so scared and they're not coming. Should I go to the urgent care? Because they might get to me faster. I said, do not leave, because if you go there, they're going to send you right back. And he literally sat there the whole night by himself. He finally got treated with the monoclonal antibodies. He came out, and what do you think he told me 2 days later? He said, I feel so much better. I sent my wife to go get the vaccine that day. Literally like that. He had to learn the hard way. And that's what happens. We have to somehow learn by trial and error. Compared to if you listen to the medical professionals, you would say, you know what? Dr. Jasper don't have a reason to lie to me. He ain't never bullshit me before. Why would he start today? I'm not. I'm going to tell you what I think. You literally make your own decision. From there, if something happens, it's your choice. But don't not do it just because you have all of these excuses and the person sitting right here wanting you to do that.
Yeah. For a long time, I was so, like you said, when I first started, I was like, you know what, I just don't know. I don't take a flu shot. Mm-hmm. I've got a flu shot one time in my life. Mm-hmm. It was because the employer I worked for at the time sent people to every office mm-hmm. and said, hey, if you want flu, I was like, yeah, why not get it? No problem. Didn't have any side effects, no issues from it. Mm-hmm. But I've just I'm not a sickly person. I rarely go to the doctor. And being in this profession, mm-hmm. we had a lot of customers that caught it. A lot died. It was a little scary. We take all the protocols and follow all the guidelines. When it was vaccine first came out, my father, I was like, go get it. Mm-hmm. Like, no questions asked, go get it. He's an elderly guy, has all the premorbidities that, said, go get it. Got it. He had no side effects, no nothing. Mm-hmm. Great. My brother-in-law, and my sister, not that long ago, got work, got it, the whole new variant, mm-hmm. everybody was doing it. Brother-in-law said, company said I got to get tested. Mm-hmm. Test positive. My sister test positive. It's like, man, I'm going to get this damn vaccine.
Yeah, absolutely.
When it started hitting close to home, I was like, you know what? So I go get it. Mm-hmm. Well, as they, because they're all there 14 days, thank God, mm-hmm. they also had, they've had one of the shots before getting tested. Now they're told that they can't get it for the second shot because they got to wait. However, mm-hmm. there's a waiting period because of antibodies. I don't know if that's how true mm-hmm. it is, but that's what they were told. Yeah. But my dad was with them in the, like, before they knew that they were had it. Mm-hmm. Well, last week was like, man, please go get tested. You know, like you've been around them before. Like they have no, I say symptoms. They had stuffy noses. My sister lost her smell and taste, but nothing severe. I was like, just go get tested just to make sure. Finally, hard-headed old man goes get tested. Test positive. Freaked him out. He was like, and I said, but you're okay. Like, just watch yourself because he's been fully vaccinated for a long time. And now tomorrow is his 10th day, or maybe next week is Monday is his 10th day. He has not had a single side effect. He has not had, he saw us cut my grass yesterday. He's 76 years old. You know, he doesn't cut his grass no more.
There you go. Right. Yeah.
So, and again, I'm still, look.
You're still on the border.
Do what you got to do. If you don't want to get it or you have questions. But like you, I was in, and we had this conversation a couple weeks ago in an episode. It was like, I'm still 100% do what you need that you feel is best for you and your family. But make sure your argument is discussed with a physician. Yeah. You know.
So, in my retrospect, I haven't taken any of the shots. I never took the flu shot, and in the actual world I work in, we actually went into customers' homes prior to COVID to where customers weren't cleaning. And we done made it throughout the whole year, going into another year, and nobody in our office or profession had it. You know, so to me it's kind of stubbornness, like you were saying about the other guy. And my kids have asthma, so I want to get them the shot. But I'm going to be honest with you. With me, I'm not saying it's not legit or nothing like that. I might be that stubborn guy too. You know, I just think that I'm all right. You know,
I'm gonna ask you a question, and this is another question again. Assuming you're a patient of mine, one of the things I often say is not only thinking about you right now, but let's say for whatever reason you don't get the vaccine, you get sick. Now you're either in the emergency room, or you're quarantining at home, or you're in the hospital. Who's the breadwinner in the household? You don't even have to answer out loud. Just think about that. So what happens when the bread stops flowing? Because what people forget is that when they think, oh, I get COVID, it doesn't go away like that. So now you're literally not making any money for 2 weeks, 2 months, 3 months. Remember, the guy I told you, he's a barber. So he couldn't cut for 2 months. Money was gone. And we think, oh, well, look, I'm going to be okay. You might. But then you don't think about the financial impact, plus going to the hospital, plus getting these experimental treatments, because people are like, oh, the vaccine is experimental. What do you think is going to happen when you get to the hospital? They're not going to give you some aspirin that's been around for 30 years. They're giving you new stuff.
That was my determining factor. I said, man, you know, the whole FDA thing's not approved. And he said, the doctor, I know it, he said, man, what you think we treat you with? He said, none of this is FDA approved. Right. The treatments have changed in the last 18 months. What we were treating with initially is completely different what we're treating for now. We've learned so much. And I'm like, that's real. I never heard that. So that changed my position a whole lot.
Right.
You know?
So
go ahead.
And that's a thought. I understand that. You know what I'm saying? And I kind of put money away well. Yeah. And just to see it actually wipe away is something that actually could happen. Yeah. You know, but it's still a if in my corner.
I get that. And that's why I say my thing is not to try to tell you got to do what I say. It's laying it all on the table. And if you walk out and say, I'm still not doing it, you'll say, but look, I thought about all this. Right. But what happens with a lot of people is they don't think about it until it happens. Right. And at that point, they're not prepared. I had a person who literally the same thing. When I say, well, who's going to make the money if you're sick? They're like, oh, okay, let me go get that. Because they were like, no one's working but me. Right. And if I get sick and the money stops, then no one eats. Right. And then the thing that the other guy, the one that I just told you about the story, he got sick. Nobody in the house was vaccinated. Then he gave it to his 2 kids. And that's when he woke up because he was like, wow, I can get my kids sick. And nobody wants to get their kids sick, right? I've never heard a person say, I'm not doing this. I don't care about those kids, right? Most people are like, you know what? If I'm going to keep my kids safe, I need to do this. And that's the part. So you're not just vaccinating yourself for you. You're vaccinating yourself for everybody who you come in contact with on a regular basis. And you're vaccinating yourself, believe it or not, for Dr. Jasper. Because you stroll in here coughing in my face, and now you get me sick, so now you're taking my family's money, and you're taking my...
All right, so sorry about that. We had a little technical difficulty, but we're going to get you right back on your thought on the COVID and where we're going with that. I'm sorry.
Yeah, I mean, I think overall the idea that I was kind of winding to was that healthcare workers are those people who we're constantly doing what we call do no harm. And that's what we're most of the time taught on. Like, first, do no harm, meaning no matter what a person does, no matter what their background, we want to treat them like, you know what, they're a person that we want them to get better, right? So a lot of times, even if people disagree with us outside of the clinic, outside of the hospital, we still take care of them. So we're not going to tell you, healthcare people now, healthcare trained people, not folks that are in the healthcare field and have no training, those people who have been certified, licensed, and all that. We're going to tell you, look, this is what we really recommend. This is why. And we want you to hopefully listen. If you don't, that's fine. That's your choice. But the idea is that we get exhausted by having to do it over and over again. And it's often the people who literally don't listen on the front end. Then they come to the hospital and now they want to listen. So then the question is, well, why would you listen to us when you're sick, but not listen to us when you're healthy? That's like saying, I'm going to wait to listen to the mechanic when I mess my car up, but I'm not going to listen to him about getting my oil changed. Like, why would I need to get my oil changed? I mean, my car's fine. It's like, well, we want it to stay fine. So my thing is always telling people, I'm going to try to tell you everything I can to keep you from getting sick. And if you trust that I know what I'm talking about, trust that I'm going to tell you the truth, and you, hopefully listening, will stop having all these problems. When you don't, that's where we run into the issue. And a lot of the healthcare workers are at a point of, they don't listen to us beforehand. But then they come to the hospital and they want us to do everything. And it's like, it's too late by that point. They're literally on their deathbed asking for the vaccine. And we're like, we told you to go get it 3 weeks ago. And that's what I always try to get to people. I hope you don't have to learn that way. I pray you don't have to learn that way. And when you show up, as much as we're exhausted, we're still going to take care of you. But don't wait until you're damn near on oxygen and can't breathe to say, I probably should take the vaccine now. Because by that point, it's too late.
All right.
Mm-hmm. So that's it in a nutshell.
Well, it was pretty informative. I won't lie to you. I'm gonna get my kids vaccinated.
What about you? You still on the fence?
Still on the fence?
I'm not really. I'm on. I see what he's saying, and I feel myself like the 3 people that's been in the hospital. I didn't put myself in their jeans, and I don't want to be there. But yeah, right now, I want to be honest. I'm still on the fence.
I got you. And that's why
eventually. I mean, I ain't go because I'm looking at the 3rd booster shot, and I'm saying exactly what you're saying. Like, man, they doing so many strands. That means if I do have to take it, I'm gonna have to just bombard everything at one time and end up still be bad off than I would if I start taking it in consecutive shots. So I think about it a lot more than I did previously. I won't lie to you, but it might take me another 2 weeks.
Yeah, and that's okay. And I feel like that's okay that it's not happening today, right? Like if I told you to go do something and you literally ran out and did it and didn't do your own research, I'd be nervous, right? People, some people feel real confident, like, listen to me because I know it, and if you listen to me, you're going to be right. I mean, if you feel like, I put it like this, if your doctor feels like that, I think you should probably really get another doctor. Because if the doctor is the end all be all, and if you do what I say, everything. No, like, that's never my approach. My approach is, look, I've given you the information. Let's do it together. Let you go do some research, ask some questions, and let's figure it out. And you just said something that was probably more powerful to me than a lot of other things. You said, I'm thinking about it more. You didn't say, oh, whatever, and let's just walk out the door. You were like, you know what, I'm going to think about it more. Maybe a week or two, and that's fine. Just do everything you can to not say a week or two, walk out, and then don't do anything. Of that. Because that's where you're going to have that issue, and that's what a lot of people say. They'll sit in the clinic, I'm listening to you, I'm going to go do whatever, and then I'll see them a month later, and I say, well, what's going on? I don't know what you're talking about, right? Like, they didn't listen to anything, and at that point, then they show up, and they're sick, and they're like, well, I should have listened to you. I'm like, no shit, right? Like, I told you that 2 months ago, right? So the goal is trying to take that actual energy, take the conversation, and hopefully build on it. And build on it enough to where when you finally make your decision, again, you're comfortable with it, not just, well, I never got around to it. Because, again, it's going around. COVID is not across the country. It's not across the globe. It's literally across the street or across the table, across the room. So if you're literally thinking that I have time, that's one of the things you're not going to have, right? Because if it gets sick, if the virus gets stronger, people are getting sicker. And the people that are getting sicker are the ones that are dropping off, and the ones that are potentially knowledgeable, practicing social distancing, hand washing, all that, those are the people who are usually doing better. And I'm not saying it to try to scare folks. That's not my approach. My approach is just to say, look at what is going on. Look at, people often are listening to folks that don't really have any skin in the game like you. They're telling you X, Y, and Z, and they really are nowhere near your situation, right? Your politician is telling you this, and your politician don't live nowhere where you, right? They live in a whole nother state, and you're listening to this person. So look at the people around you. Look at the people who are potentially in the room with you and see what's happening. And if everybody is doing something and they are doing well, more than likely you may want to consider what they're doing, right? And that's health-wise, financial-wise, mindfulness-wise. If they're doing these things and they're working out pretty well, nothing wrong with finding out what they're doing and trying to mimic them. Don't have to do exactly what they're doing. But don't say, well, they're over here making 6 figures. I'm going to ignore them because, I know what's best for me. Maybe you do, but I'm pretty sure the 6-figure people know something too, right? So think about it like that too.
Yeah, I just still can't believe the amount of people that have, that listen to politicians over doctors, or that even allow politics to be in a medical discussion. There's not too many scientific or medical geniuses that are on Capitol Hill. It's just not. Right. There are some that are previously practicing doctors or something like, and I get that. But if you really look at them, they haven't practiced medicine in quite some time. So they're not in the loop. They're not reading these medical journals. They're not reading these reports. And if they are reading them, they're thumbed through them, or they have a staff of reading them and cliff noting or footnoting certain things. Say, hey, look, this is your talking points and something. Correct. So it's just like to get with doctors, man. Get with somebody that's, like you say, has skin in the game, and that's actually has your well-being. It's not about money. It's not about any crazy conspiracy theories.
And one of the things I often also articulate, which comes into the vaccine, but people don't realize it. Asking people to engage in a vaccine or any other medical treatment in a very cursory sense is ludicrous. And you'll say, well, wait, what do you mean? A lot of people are often tasked with going to trust somebody to give them a vaccine, and they don't know anything about them. So I always tell people, what I want you to do first is get you a primary care doc or a primary care practitioner and have that relationship. So when it's time for something medical, you know them, they know you, and you're more likely to listen. Because if you came to me and I have no financial relationship with you, and you tell me, I need you to give me $1 million to do this business venture, I'm going to be like, I don't know you. But if I've done business with you for 6 years, I'm like, well, he's probably legit because I know this guy. Right. He knows me. He knows my financial situation. But what happens with medicine, it's, well, I don't know anybody, but I want you to listen to me because I'm a doctor, and even though I don't know you, you only going to see me today. You should really and truthfully listen. And I'm like, no. So my thing is, if you have a primary care practitioner, primary care doctor, a clinic, whoever, and y'all have that relationship, it's a lot more likely that you're going to have a better medical outcome because you have that relationship and that history. So I'm always advocating for primary care. People say, well, you're a primary care doctor. Absolutely. And I'm going to tell you, if you're in primary care and you have a consistent relationship with those patients, they're more likely to listen. So guess who calls me all the time and asks me about the vaccine? My patients. Hey, Dr. Jasper, should I go and get this booster? I had a lady call me yesterday. You know my history. You know my situation. And I'm looking at this job. Do you think I should get it? I was like, absolutely. I was like, if you're about to do all that, absolutely. But it's a lot easier for her to talk to me because we have that relationship. But a lot of patients and a lot of constituents, whatever, you're literally hearing all these messages from all these people about go get the vaccine. And nobody's saying you should just go and get into medical care. No one's doing that. What commercial do you see, and what public health message do you see? Do you have a primary care physician? If not, these are all the places you should go. It's none of that. It's vaccine, and everybody's putting all the money into the vaccine, which is great.
It's a very
but
good
no one ever argued, instead of all the money we put towards sick care and emergency rooms and all of the surgeries, no one says, what if we took all of that money and put it into just getting folks into primary care? Maybe it would be a lot easier to vaccinate 10 million people if 8 million had primary care doctors.
It's not big business.
Oh, it's not. It's not money made on prevention. It's not money made for you to come see me and me to literally tell you I can save you money. That's not the way it works. So what am I going to say? I want you to wait until you get sick as you know what, and then go to the hospital. And that's where the money comes. So they're not putting money into prevention or into primary care. They're putting it into vaccines and things like that. Vaccines are great. I'm an advocate for vaccines, but I'm more of an advocate for preventative care all the time. Yes, and if you're engaged in primary care with whoever, Dr. Jasper or whoever, you're more likely to get the treatments you need and not wait until cutting edge breakthrough virus, pandemic, and now it's like, okay, well, now I guess I should go and find a care. No, I'm already in care. Let me call my doctor. Let me call my clinic, and I'm more likely to get an answer about my health, my situation, my family, and what to do. And I constantly try to argue that all the time.
Changing that culture is hard, though.
Oh,
Because
yeah.
I can say, like you said, so many people have been preconditioned to. I'm one. I do not have a primary care physician.
Yeah.
I don't. My kids do, but it's like I don't go. So because it's I feel like it's a runaround.
Yeah.
I go in there. It's always so much time.
It's tough.
You got to roll. We can wrap up. You got any questions? I mean, I can talk to him for days.
I know.
So,
Yeah.
Well, I really don't even have any questions. Like, I took a couple of footnotes and stuff like that just to be able to educate the people off our page, and then educate the people in the biz and multiple social media platforms that don't know. Like, I know people that just went to the doctor and ain't have any insurance or nothing, and didn't even think that they might have had a way to pay for their health care like this, And I know some people, like he say, that's paying maybe close to $100 for the acid reflux medicine, and they could get it for, I think he said $9 or $10
A lot cheaper. Yeah.
for 90 days.
for 90 days. You know what I'm saying? Like, I know a lot of people that has that situation, and they all say, man, the medicine is so high that it'd be destroying them.
Yeah.
So, that's
Same,
that's
like
pretty much
seniors,
my
the same
option.
thing. I mean, I know my dad's paying $600-700 a month, for just, he's an old guy,
Right.
like handful of cholesterol medicine, stuff like that. And I'm sure it's nickels on a dollar compared to what you're getting anywhere else.
Yeah, I had a lady literally signed up for 2 weeks ago. First visit was Wednesday. She had a history of breast cancer, so she's taking hormones. And she said, can you order this medicine? And she slid it across the desk. And I said, I'm not sure. Let me look. And she said, okay, if you can, I want to know how much it costs. And I said, okay, well, how much does it cost you now? She said, for one bottle, 30 days, one pill a day, $60. For me, it was $4.
Yeah, we got to get this out. Man. We got to get this out.
And the part that I laughed about it is she thought I was joking. Like,
everybody's got to think you're joking.
Right.
I mean,
and that's why I said it's funny to me. Not
it's
in a
cheaper than Tylenol.
Right. It's funny to me, not ha funny, but it's like why would I lie about that, right?
Well,
like,
because
and that's what I'm saying. Like, and it's not even me being facetious. It's that we're so conditioned to distrust so many things that even the doctor sitting across from you, you're like, wait. Like, and at this point, I think when more people start to see how I am and how I operate, and that there are a bunch of people like us out there, direct primary care doctors are all over. I just happen to be one of the ones that probably are a little more vocal. But the idea is when you learn how this works, you'll start to realize, you know what? There's different ways to get health care.
right.
And you're not threatened by anybody. You're not you're not nobody's pocket. You're not in pharmacy's pocket. You're not in insurance pocket. So it's like, look, honesty is truly the best policy.
Yeah.
Like,
and that's tough, but it's there. So I appreciate y'all for having me. Again, y'all, as you can see, I talk about this all the time. But I think the goal is, again, as we have talked about, making sure people know that we're different, but it's really just having conversations. Honest, open conversations, not arguing. Even if you do disagree, agree to disagree.
Right.
And then from there, the more you learn from different people, the more you start to literally say, you know what? I can take a little bit from this, a little bit from that, a little bit from that. Like, and I'm gonna be honest with you, I didn't realize the whole 2% mortality thing as much was an issue until I wrote the post about vaccines and people started reaching out to me. Like, I didn't realize that. And it wasn't because I didn't know it. I just didn't think people thought about it like, well, it's only 2%. And for me, it was eye-opening. It was like, okay, so you have to realize how your message comes across, that to some people, they're thinking, well, if I'm not dying, it's not a big deal. Or it's only 2%. So it's really and truthfully, you learn from everything. Every mistake, every bad business deal, I try to learn. And I don't get it right all the time. But I do know that I'm not going to keep getting it wrong.
Right.
And the more you do that, I think platforms like this are good because it helps people to start opening your eyes and ears to, there's a different thought. I may not be completely right, or even if I am right, I can still learn from that person. And I think this is great. So I love what y'all are doing.
Appreciate it. Man.
Absolutely.
So
closing words on you, team?
I mean, my words are always the same, and it's just great to actually have a doctor, because a lot of us stay away from hospitals and clinics just because of the financial reasons and because of the distrust. no offense to anything, but my man's has a shirt on. He like his doctors like he like his coffee, and it's been a conversation in the community. You know, not to take anything away. Not to take anything away, but we have to get into times to where we could go to people that come from where we come from and went through what we went through, so they could know off jump the symptoms or what we may be experiencing. If we go into people that don't actually have it, but they have the knowledge and they don't really deal with it every day, they only gonna give you the book version.
Yeah, absolutely. And we might be here a little bit longer because you just opened up another conversation. Another thing that we talk about in the shirt that I'm wearing is from my nonprofit about getting more minorities in the medical field. I often argue, and I argue about diversity all the time, that the idea is people get offended in the medical field when you say, I want a fill in the blank doctor. Like, now it's tough because we, black doctors, often hear, I want a white doctor. And you know what they say? Some of them are really offended. And I'm like, in a way, I get it. Because white people sometimes feel more comfortable with white people. So why is it offensive if a black person says, I want a black doctor? Like, all of a sudden, it's like, well...
Or a female wants a female gynecologist.
Right. So to me, it's like, I'm glad you told me, because I'm not going to waste my time because you want the white doctor that you identify with and you trust. It's just when it's more of the, I don't like black people, there's the problem.
Yes. Right.
Not, I prefer a white doctor because I identify better with a white doctor. That's not usually the case because we're so used to being conditioned that white is the only way. But when you say you want a doctor who looks like you, speaks like you, comes from where you come from, it makes sense. And the argument that I tell people is, if you came in and you only spoke Spanish and you said, I want a doctor who speaks Spanish, what would most people say? Okay, I get it. But for some reason, when we say it's a black person and they want a black doctor, it's like, well, I don't understand. Or a Hispanic person wants a Hispanic doctor. Like, to me, it makes sense that we need more representation.
No doubt. No doubt.
If you have more people that look like others, that come from where they come from, across the board, and I'm not just talking about medicine, just period, we literally do better. Diversity increases profits. It increases the culture of the business. People feel more comfortable. They feel more welcomed, less stress. So,
and it's
medicine,
easier to learn. It's not a forced deal. Like, hey, I saw you had such and such, Miss Wanda over here, and she had sugar diabetes to where she couldn't feel a feeling. I have a patient over here that has it, but I really don't know what I'm doing with that. Could you help me? Like, I done did this check what the book says, but none of that's working.
Correct.
You know, it brings a conclusion.
Yeah,
and
you have a cultural feeling, just like we talk about neighborhoods growing up. Like, even though we have so many similar stories on how we grew up, there's still what happened in the household, what was talked about in your house, that it was completely different.
Right.
You know, so you're gonna relate to one another, a
lot differently.
Yeah. And so it definitely helps with being comfortable, being familiar, you can diagnose them easier because they're gonna be willing to tell you more family history.
You just said it. They're more open, right? A lot of people feel differently when someone walks in and it looks like it's just automatic, right? Like you automatically let your guard down just a little bit more.
And you can't explain.
You just can't.
It's just something that's in you.
You're more comfortable around people who are, and again, let's take it out of race, let's take it out of gender. If you literally said, I'm from Chicago, and the doctor walks in and said, I'm from Chicago too, what you gonna say?
Man, how many times you been to a college
all
game,
of a sudden,
man?
The whole thing. Or, I love fishing. I love fishing too. Like, all of a sudden things change when you have that similarity. So I do know diversity is great in certain ways, but there's also a thing for similarity. So you have to find a way to make it work. And I think one of the things is having conversations and also being open to the idea of trying something new. And having exactly what you said, that look, the idea of having different doctors who come in and actually make people feel comfortable is great. And that's where those relationships come. That's why I'm always talking about primary care and finding doctors and nurses who look like you, who make you comfortable. And it doesn't always have to be that you have to have a person of the same race or same ethnicity or same gender, but you need that comfort level. Right? So if you say, well, I don't have a primary care doc because I'm doing pretty well, but you find one that makes you feel great, you're going to be like, of course I got a primary care doc. He's amazing.
Right.
She's amazing.
Well, I can tell you just from this conversation.
You're going to find one, huh?
Well, probably not. well, this is the reason why, because even I'm a very vocal. You know, I have no problem talking to anybody, but I've never had I can tell you now, if you were in our area,
Yeah, absolutely.
sign me up, done. You know,
Yeah.
See, I don't.
And that's why I say everybody's different. But
Yeah.
when you find that person, it changes everything.
Yeah.
Like if you find that, and you talk about financial, you find that person who helps you with your money the right way. All of a sudden, you're like, look, everybody needs to call this person. He's great. He helped me so much. Like that's just how it is. That's the culture of anything.
Right.
But we don't think about that in medicine because we're so used to, well, my mom saw this person for 30 years. She took me to go see him. And you go into and you're like, I don't like that person. I hate going there.
He or she is 90.
Right.
You
Exactly.
know?
Cannot relate to you
Right.
at all.
And you just keep doing it. And it's because no one has ever came and said, there's a different way, right? Like no one ever thought that in medicine because medicine is so traditional. It's so antiquated. It's so old school that you just do what you were taught. So when I come in, the young black doctor who does everything different, people are like either one or two things. This is great. Or I don't trust them, right? Like it's one of those two.
Nothing's in the middle.
And that's okay. But again, though, what happens is eventually the people get tired of, I don't trust these people. And eventually they get worn down and they try something new. And we're going to be here. And I tell people all the time, you don't have to sign up with me today. I'm not going anywhere. You call a number in 3 months, I'm going to answer. And most of the time, people are surprised when they call me and the phone rings and I answer and I say, hey, this is Dr. Jasper. How can I help you? And they're like, the doctor?
Really
Right. Like the doctor answered? And I'm like, yeah. Right. So the point is, when you have that relationship, everything changes. Your health changes. Your approach to medicine changes. Your approach to engaging in the medical system changes. Your approach to getting a vaccine changes because that has actually opened up. But until that changes, it's going to be the same old stuff. The same people getting sick. Same people being the first people in the hospital whenever something like this happens. And it's usually the black and brown people. And it's because we're the slowest to listen to good advice because of a bunch of factors, even though it's staring us in the face. So I often advocate for black people. Find you the black doctor if that's what's going to help. Or find you the young doctor if that's what's going to find you the female. And a lot of people as I say, they clutch their pearls. Like they get really like, how could you say that? And I'm like, look, they've been saying it for a long time. I'm just saying it differently. Right? So go to that person before something happens. So whenever it does, you already know, hey, I know where to start. I know who to call. I know what to do. You don't want to wait until you get into trouble to say, well, I probably should have had this worked out, right? You don't wait till the house floods to say, well, I probably should have had flood insurance. Right? But that's what we do. It's when we get into that trial and error is when we say, okay, now let me learn. Same thing for health.
Always a proactive. I mean, it's always a reactive instead of a proactive approach to everything.
Yeah, and that's why you hear me arguing all the time. So the more we can get people into primary care, I think things change. But also the more we can get people that have representation and diversity in these spaces, it's even better.
That's awesome. Well, man, I definitely appreciate you coming and do this with us. It's been a blast. I know I've learned so much. You guys, if watching, if got any questions, can you give you clinic information again?
Yeah, so it is Byja Clinic, BYJA Clinic. Our website is www.byja.org, byja.org. We're on social media, so we're on Instagram at Byja Clinic. We're on Facebook at Byja Clinic. And of course, we have emails and phone numbers. If you have questions, feel free to shoot them over. Feel free to give us a call. Love to hear from you.
Awesome.
Hey, and like they said, I'm just going to rumble off. This was an excellent podcast. We didn't ask many questions because the guy was so informative. You actually really didn't need to. Like every question you pretty much thought about to ask, he covered it just off of talking. So that alone lets me know he's into his profession and his primary care to the people, not to the insurance companies. And that's major because it has a lot of us out here without insurance. And we're making a good bit of money nowadays. So 120. You can't beat that, man. You can't beat that. So look him up.
Yeah, let me know. And I'm sorry I have
go
to
ahead.
say this.
Good.
We do take care of patients outside. I'm in Baton Rouge primarily. We are hoping to expand to other areas, hopefully in New Orleans, hopefully Oklahoma. But I have patients that literally come from all over. My furthest patient right now comes from Mississippi. She drives 2 hours to come see me. And I have several patients who come from Houma to see me. And they don't come every day. They have the idea to do telemedicine. So if we need to see them in person, they'll show up. And obviously we schedule way in advance. But if they have small visits like, hey, we need to adjust medicines, that's simple. Literally, we do a regular conversation like this over a virtual platform, and we have a visit. So the idea is you don't have to necessarily always be in the office. That changed. The pandemic sped that up. We actually, in the direct primary care world, we're doing a lot of virtual visits before the pandemic, but the pandemic kind of blew the lid off to where more people are doing it.
Right.
So I say that to say, don't feel like, well, I'm not in Baton Rouge, so I can't. That's out the window, because a lot of people still come and visit and engage with us, and the goal is to find that works for them. And if it doesn't work, again, you unenroll, no problem. But my goal is to get as many people into primary care as possible. Not my care, primary care. Now, if you want to come with me, great. But if you say, well, I can't come with you, is there other things? We'll try to find something. And that's my goal. So,
again,
networking, he isn't in it alone.
Yeah. I mean, look, it's amazing what you do. I'm so glad that you were able to come on with us, because the information you provide, again, I had 100 questions lined up in my head about insurance, pharmacy, all these things ready to roll. And you nailed everyone as you're going. I was like, I'm going through the website going, okay, what else? Where are we going? And he was hitting it before I could even, come up with the question. So I appreciate it. It's amazing.
Right.
Yes.
Right.
Eventually it comes like that.
15 years of practice.
Unbelievable.
Yes.
Well, again, I appreciate your time. I'm glad you came.
Yes.
Again, y'all check him out. And remember, the divide is not so wide.
I'm going to use Cody words, peace, and to